As you start your nursing career in 2025, here are some of the few things you need to unlearn to stay updated and to improve in your practice. So, number one thing or number one key point that you need to unlearn is outdated medical practice. Unlearn outdated medical practice. Medical knowledge, um, medical knowledge and practice are constantly evolving. Unlearn old medical procedure, old medical techniques, old drugs that are no longer in use, old approaches in taking care of the patient, and learn those old or anything that is old that is not bringing benefit to patient, and learn it. Another thing that you need to unlearn is rigid thinking about patient care. What? Rigid thinking about patient care. In the past, nursing have been viewed as a strictly task-oriented job. However, modern nursing emphasizes holistic care. Yeah, holistic care. And then it also emphasizes on critical thinking and also patient advocacy and teamwork. So unlearn idea that nursing just follow orders. Long time ago, people used to think, or they made nurses to think that they only follow orders. When a doctor maybe say or order or write or prescribe a drug for a patient, nurses were not in a position to question. But right now, that thing is not there. You prescribe that drug as a team.
When a doctor wants to prescribe a drug, they have to consult with you. You have to consult with any other. That is why we are saying teamwork is very important during the management of patients. Another thing, a very key important point is overlooking technology in healthcare. Let me say this. While technology can be overwhelming or can be tiresome, you need to embrace electronic health records, telemedicine, and other digital tools that are now integral in patient care. So, unlearn skepticism about this innovation as they improve efficiency and patient outcome. Another thing that you need to unlearn in 2025 that nurses are just helpers. That mentality, get it out outside your brain. Nurses are not just helpers. Remove that mentality in your mind. Nursing as a profession has their own right. They have their own procedure of managing a patient. They are not just a helper. Nurses are allowed to make decisions of their own and be responsible of those decisions. So it is not that mentality was there when we were still managing patients according to what Nightingale wrote. But right now, nursing is a career. Nursing is a profession. Nursing has all the, how do you call them, the guideline and how to manage patients. This word is not coming out. What I'm trying to say, and learn that mentality that nurses are just helpers. So you have to read, learn, and understand, get the right thing, do the right thing,
consult with other people, ensure you involve in teamwork so that you take care of the patients as they are supposed to be taken care of. Another thing that you need to unlearn is neglecting self-care. Nurses, sometimes you take a lot of time taking care of other patients or other people, or considering or putting your all effort in other people, but leaving yourself without taking care of yourself. You find that a nurse do 24 hours shift without even taking care of themselves. They don't eat, they don't have their time even to think about themselves. So that thing, you should unlearn it, and then you should find the time to take care of yourself. Go for your holidays, find hobbies and get your hobby. This thing that you neglect taking care of yourself, it will bring mental breakdown for nurses. So unlearn it. In 2025, we are dealing with technology. We are not using our energy to take care of the patient. We are using and technology. Another thing that you need to unlearn is that this assumption of one size fit all. What do I mean? There are those, or in the past, there were those procedures that were meant to manage a specific or maybe a condition. Right now, we are dealing with a patient. Every patient is unique. You deal with that patient according to the presentation of the sickness of that patient. Yeah, you don't assume a procedure, or you don't assume management of a particular condition in terms of managing conditions in the patient. I don't know if you are getting what I'm trying to say, but I'm saying unlearn that one size fit for all. Every patient is unique, and learn any tendency towards generalizing care practice that do not consider individual patient need or preference or background. Yeah. Another thing that you need to unlearn is fear of speaking up. This thing that all nurses want to say that they are introvert, they don't want to speak up. You should be able to speak up. Nurses often feel hesitant to speak out, especially if they are in harsh environment. So they are not able to speak out what they think. They are not able to correct some of the things. Nurses, you have your own rights. Yeah, you know your rights. So learn how you can speak out if something is not done right. Because if you don't, then you are putting other nurses who are coming after you at risk, and also you are putting yourself at risk of so many things that I'm not going to say. Another thing that you have to unlearn is old communication techniques. Old communication techniques. Communication is key in healthcare. Unlearn outdated methods of communicating with the patients, colleagues, and anybody in the health system or in the institution. So unlearn those old techniques, those learn those outdated method of communication with patients and colleagues, and also promote clarity of empathy or collaboration, and then ensure there is active communication skill, active listening, and clear communication between you, the patient, and the colleagues.